Hi, my name is Linda. In this video I shall explore all about osteoarthritis by explaining the various aspects, including its causes, symptoms, and progression. Also, I shall cover risk factors and how to prevent them so that you can get back your independence. Whether you are newly diagnosed with osteoarthritis, caring for someone with the condition, or wanting to understand more about this terrible disease, this video is for you. So first I shall explore what is osteoarthritis and its types. Osteoarthritis, or OA, is a degenerative joint disease that is known as the wearing away of the joints and the cartilage surrounding the joint. The cartilage is a flexible tissue that covers the ends of the joint bones. The cartilage deteriorates over time, leaving the two bones of the joints to rub together, causing pain, swelling, and decreased mobility. The condition is most common in the elderly, but it can affect adults of any age, especially if you have a history of joint injuries or a family member has the disease. Osteoarthritis is a common type of arthritis that affects people worldwide and is the leading cause of disability, through the impact of the joints being unable to do everyday tasks and reducing the quality of life. Osteoarthritis mainly develops in your hands, knees, hips, and spine. There are two types of osteoarthritis that can be categorized as primary and secondary. The primary osteoarthritis occurs without any distinguishable underlying cause. It is generally related to the aging process and the increasing effects of joint wear and tear. The primary type commonly affects the fingers, thumbs, spine, hips, and knees. The secondary osteoarthritis is a result of a recognizable cause or underlying condition, such as joint injury, repetitive stress, obesity, or congenital joint abnormalities. The secondary can develop at a younger age and may affect any joint previously subjected to trauma or stress. Such as in my case, I fell on an icy patch one day, where my right knee hit the edge of a curb. In 1970 the pain got so bad that my doctor sent me to the hospital, where they found that the right hip was so bad I needed a hip replacement. Well, now I have developed osteoarthritis in my other hip, both knees, wrists, and shoulder along the top of my back and my left elbow. Number 1 is cartilage breakdown. A healthy cartilage allows the joints to glide smoothly over each other as you move, and absorbs shock from physical movement. However, in a diseased joint, the cartilage deteriorates and loses the ability to function properly. This breakdown leads to pain and stiffness in the joint. Number 2 is that your bone changes. As the cartilage wears away, your bones may start thickening and form osteophytes, which are bone spurs. These bony projections can cause further pain and limit joint movement. Number 3, synovial inflammation. The synovium, that produces the lubrication fluid for the joint to move smoothly, may become inflamed and thickens in response to cartilage damage. The inflammation can contribute to pain and swelling in the joint. Number 4, joint space narrowing. The space between bones in the joints, over time becomes narrower as the cartilage deteriorates. The narrowing can be seen on X-rays. When you develop osteoarthritis, the common joints that can become affected could include number 1, the most common one is your knees, which are one of the weight-bearing joints. This means that it is vital that you are at a healthy weight, as it can lead to disability and difficulty in walking. Also, you may have difficulty doing daily activities. The second most common joints are the hips. With the hips you may develop pain in your groin, thigh, and buttocks. It can cause severely limited mobility, and you may require surgery, such as in advanced cases a total hip replacement. The third is your hands, often the joints at the base of the thumbs, the ends of the fingers and the middle joints of the fingers are mostly affected. The symptoms can result in pain, swelling, and reduced grip strength. And fourth is the spine, particularly in the cervical, neck, and lumbar, lower back regions, and can lead to pain and stiffness. In severe cases, it could cause nerve compression and radiating pain called radiculopathy. There are many symptoms of osteoarthritis that can vary widely and can range from mild to severe. The common symptoms include pain. This can be either aching or sharp pain in the affected joint, which may worsen with activity and improve with rest. Stiffness in the joint can be caused by periods of inactivity or in the morning. Swelling is another common symptom that can develop around the joint due to inflammation or increased synovial fluid. Other common symptoms could be reduced range of motion. You may have a grating sensation when you move the joint. This is called crepitus. The area may become tender when applying light pressure to or around the affected joint. Lastly, you may have bone spurs, which are hard lumps that surround the joint. This is called osteophytes. To prevent getting osteoarthritis, it is important to understand the various risk factors that are related to this chronic disease. There are two types of risk factors: the non-adjustable and the adjustable. Firstly, the non-adjustable. This can include your age, and developing osteoarthritis can increase the symptoms as you age, as the wearing down of the joints over time becomes worse. Gender is another, as women are more likely to develop osteoarthritis, especially after menopause. This could be due to hormonal changes. Lastly, genetics. If a family member has a history, it can increase your risk. Now, the adjustable risk factors. These are risk factors that you can prevent the disease from getting worse. The first is if you are obese, as excess weight can put additional stress on weight-bearing joints like your hips and knees. Another one is joint injury. A previous injury such as a fall can increase the risk of developing osteoarthritis in the affected joint, or an occupational hazard. If a job involves repetitive movements like lifting heavy boxes, you may be at risk. And lastly, physical activities. If you just sit around and do no physical activities, you are contributing to the development of osteoarthritis. Diagnosing osteoarthritis typically involves a combination of clinical evaluation and diagnostic tests. This includes medical history, and it helps identify symptoms, the onset, and any potential risk factors, or previous joint injuries. They may then do a physical examination that helps to assess joint pain, tenderness, swelling, and range of motion. The doctor may also look for signs of joint deformity or instability. Then they will send you for an X-ray, which will show any joint space narrowing, bone spurs, and changes in bone structure. And an MRI scan that can provide detailed images of cartilage and soft tissues. Lastly, they will want a blood test that can rule out other types of arthritis, such as rheumatoid arthritis or gout. Osteoarthritis is a chronic condition that can lead to many symptoms, impacting your quality of life and daily functioning. Understanding how osteoarthritis works, and the symptoms, diagnosis and management strategies, are crucial for minimizing their impact. By working closely with healthcare providers and making informed lifestyle choices, you can better manage the symptoms and improve your overall well-being. I am not a medical professional, and this video is for information only. If you are worried about anything, you should consult with your healthcare professionals. I hope this video has helped you, and do not forget to subscribe to my channel and click on the bell to receive notification when new videos are released. Good luck!